So we're going to talk about doing oral cares on intubated patients. So we do this every 2 hours to help prevent ventilator-acquired pneumonia. And so what you're going to do is knock, enter the patient's room, and introduce yourself and wash your hands. Then you're going to apply the appropriate PPE, which is always gloves. You can use other PPE to your discretion and as necessary per the patient. So once you've done that, you're going to assess your patient, including vital signs, and you want to check that AT tube for any damage. The next thing that you're going to do is you're going to apply this to the wall suction at -100 to -120, and we're going to apply this Yankauer type suction catheter, which you're going to use around the AT tube to suction out any secretions out of your patient's mouth. This protective shield is just to make sure that it's being kept relatively clean. So once you have suctioned out the patient's mouth, then you're going to come back in the next time it's time for oral cares, and you're going to attach the toothbrush attachment. You're going to use a toothpaste type solution, and you're going to brush the teeth. You want to make sure that you're brushing the teeth thoroughly as to make sure the mouth is clean, but not too rough as to cause pain to your patient. So you want to make sure that you're getting the molars, the incisors. You want to make sure you're getting all the teeth and all surfaces of the teeth. That mouth should feel clean. And then you can go ahead and turn on the suction and suction out any of those secretions. So once you've brushed the teeth, then you need to apply a mouth moisturizer to all internal surfaces of the mouth, the cheeks, the lips, the roof of the mouth, the tongue. You always want to make sure you get the lips because you want that patient's mouth to be nice and moisturized. So then you come back 2 hours later, and we're going to use this longer suction catheter. And this is what's going to allow us to get further back into the patient's throat where they have those secretions that they're not able to expectorate. This is going to help us to get those secretions sucked out of there for that patient. And then we're going to attach, the next time we come in, we're going to attach this sort of bent sponge, and it has suction. You can see a hole in the end. So you dip this into this debriding agent, which is a lot like a mouthwash, and you're going to clean the surfaces of the mouth. So you're going to make sure you're getting the gum line, the cheeks, the tongue, the roof of the mouth. You can go over the teeth. You want to make sure that, just like with the toothbrush, you're getting the mouth nice and clean, but you're not being too rough as to cause the patient pain, but not too gentle where you're not getting the mouth clean. So once you've done that, you can go ahead and turn on the suction. Right through there, you can see that it'll just suck out any of those secretions. And then once you've finished, you're going to apply the mouth moisturizer again inside the mouth, the tongue, the cheeks, the gum line, and the lips to make sure the patient's mouth stays moisturized. After you finish the oral cares, you always want to inspect the ET tube for any damage, as well as inspect that skin integrity for any breakdown. It's a really good opportunity to check the integrity of the skin is during oral cares. So that's how and why we do oral cares on intubated, mechanically ventilated patients.